Welcome to MedVentures, the podcast that dwells into the remarkable journey of one of India's leading spine surgeons, Dr. Abhay Nene. Join us as we explore the world of spinal health from slip disc to back pain alongside the life story of this orthopedic spine surgeon. But Dr. Nene's adventure don't stop in the operating room. He's also a marathon runner, high altitude trekker, and a long distance cyclist. Get ready for an inspiring exploration of medicine, athleticism, and the human spirit only on MedVentures. Hello and welcome, Dr. Abhay Nene, to our very special podcast, MedVentures. So, let me first confess that you're one of my idols in the field of orthopedic spine surgery.
Thank you.
So I'm really honored that you have come and attended our podcast, and I would like to know more about you. So are my viewers.
See, Vivek, it's a great pleasure when you do a venture like this, MedVentures. I know exactly where you're going. I think this is a great venture and this is the need of the hour.
Okay.
And I support you fully.
Thank
you for having me.
Okay. So, first of all, welcome to Kerala. So, you've been coming very often to Kerala every year for a very specific course called the AO Spine Scoliosis Week. So, what are your best moments about Kerala? What does Kerala remind you of?
Oh my God. Kerala is in many ways utopia. I'm not saying this because I'm here with you as your guest, but I'm now almost like one of the members of this community.
Okay.
So I look at Kerala as the most advanced state in the country.
Okay.
And there are multiple things that are very different in Kerala, which people actually need to know, but they don't. I think what stands out, of course, we know about the literacy, we know about, the people being perceptive. I think what stands out is the equality. Okay. I mean, you just don't see glitz and glamour trying to overshadow the common man. Everyone's a common man, everyone's smiling, everyone's helping each other. I think that kind of equality across the state is very unique. I mean, we all know about the natural beauty. We are sitting by India's largest lake. And we know this is God's own country. There's green, the kind of fruit, the kind of fauna you get here. But I think what really stands out here is the equality, the literacy, and this is just one big city. It's not a state.
Right. So, and since there's a lot of Hindi-speaking population coming down to Kerala, so even Malayalis are learning Hindi now.
That will be I think a pipe dream. I'm about to learn Malayali, but and forget my Hindi.
Right. So let's go a couple of years or maybe a decade or 2 decades prior, your childhood days. Did you ever dream of being an orthopedic surgeon as a child?
No. And that's 5 decades ago.
5
decades ago, when I was a child, I was born in 1972. So 70s and 80s, at that time, a teenager was in dreamland. We were not exposed to anything. There was no external influences. There was no Google. There was no internet. There were no phones. It was quite a different era.
Right.
So we were all just in dreamland, and it was going by the flow. And it's been a series of happy coincidences, I'm going to say, with no real aim in mind. I mean, I would have loved to sit here and say that, when I grew up, I always wanted to be an orthopedic surgeon, and here I am. But that's really not what happened. It was just that things just kept happening. And, someone who's such a non-believer like me still starts thinking whether there's something called destiny when you look back at the way things went.
So what was your one profession you would have chose? If not a doctor, what would you have wanted to be?
It's hard to say, but of course, as a child, I was very, very, enthusiastic about sport.
Right.
And I used to actively, take out time and play cricket, especially. That was, of course, the flavor of the day. And I played at a pretty high level, competitive. I had my name in the newspaper.
For which sport?
And so typically cricket. I mean, my name featured in the newspaper because I played for the same club as Sachin Tendulkar.
Okay.
So, the Sasanian Cricket Club.
Okay.
So, but then after med school, that had to go. Right. My other deep passion was music. And I was like, all ready to take up music as a profession also. But again, there was just no scope back then. If you take up music or sport, there's a really slim chance that you can, buy your square meal for the day.
Right.
So it had to be a passion and it could not be mainstream. And that was pretty ingrained in us as children. Right. Today, I think it's different. Today, if I want to be a cartoonist, I can still make a career out of being a cartoonist or, a sportsman or anything else.
Yeah, the current generation has a much more varied options.
Yeah, the world has changed. And the opportunities available have changed.
Right. So what was that spark which moved you to orthopedics and then followed by spine surgery?
No, let's begin with medicine first, because there was no spark even for medicine. All my friends in junior college were PCM students, that's physics, chemistry, math, and so was I.
Right.
And my mother had insisted that you should not drop biology, so I had not dropped biology.
Okay.
And to the point that I actually took admission to an engineering college. So after 12th standard, I enrolled in chemical engineering because I was getting one of the fancy colleges in Bombay. And it was just some weeks after that the medical list came up. And my mother calls and says that, look, your name features there. Why don't you take up? And I'm like, doctor, really? Are you serious? Do you think? And then it was really a very random decision. Okay, mom, maybe you want, then okay, I would do it. I had no clue what I was getting into.
Right.
And so really when you get into medicine, you are hit by a thunderbolt. I mean, you've been there,
Right.
you know that. The language is different. You're talking Latin. You're
Right.
talking of words that you can't even pronounce, leave alone spell. So it can be quite overwhelming when you join medicine.
Right.
But the fun is the kind of people you're with. You're with people who are from the same background and who are all on the same boat as you. So it becomes one big family, and it takes a few weeks.
Right.
And then you start thinking, oh, why did I never think that I should have been a doctor? Because just the journey of becoming a doctor. I know people talk about the hardships, but I think the fun and the what you gain is far more than what you lose.
Right.
So I was happy I did medicine.
Okay.
Now, in medicine, we are exposed to medicine and surgery. Those are the two big things, and you fall in love with one of them. That's the tradition.
True.
And I'd fallen in love with surgery because it was a very boy thing to do. Very
Macho.
hands-on. You're using your hands, touch, feel, skill, and intuitive. For someone who liked music, liked sports. But there was no orthopedics. Your exposure to orthopedics is very, very minimum as a
True.
medical student. So, but yet everyone talked about orthopedics as that specialty where everyone wants that specialty. Everyone wants that coveted seat.
Right.
But yet in my heart, I said, no, but I like surgery. So why should I just fall for that trap? So on the day of the interview, I left home telling my mother that I'm going to join general surgery at KEM Hospital. And I came back saying I've taken a seat in orthopedics at Bombay Hospital. So again, a coincidence. Like I was getting that seat. There were just 6 seats in Bombay. And there were like 28 seats for general surgery. So everyone said, you're getting one of the 6. Why are you choosing one of the 28? I'm like thinking, okay, anyway, there's no background. There are no doctors in the family. I have nothing to lose. May as well go with the flow, literally.
Right. So once you took up orthopedics, there's this years of training which you go through. A lot of people have different options, focusing only on trauma, joint replacement. Spine is something which people normally do not suggest, or people are generally scared of, being a medical professional also. What drove you to spine surgery?
So that's a good question, because at this point, it was not coincidence anymore.
Okay.
Like once you join orthopedics, you're really now old enough to start thinking, start understanding what you like, where you should be putting, scaling your energies towards. And spine is so unique, I mean, Vivek, you're the same as me, and you know the whole story, but I'm still going to elaborate it over here. That orthopedics, the beauty of orthopedics is results. You do surgery and you get a result, and that's that. And it's so satisfying. The satisfaction rate is probably the highest amongst all specialties.
True.
Plus you're doing things. You're not thinking and imagining and giving medicines and praying. You're actually doing so. You're changing the fate of people in your. So it's very hard to actually drop orthopedics and become a subspecialist, or what we call a super specialist.
Right.
So whichever specialty you take, now you know that there is joint replacement, there's traumatology, there's arthroscopy and sports medicine, there's foot and ankle, there's pediatric orthopedics, and then there's spine. How do you then decide that you want to drop this and choose one of these several things that are making you happy?
Right.
So spine, I think, ticked all the boxes.
Okay.
It's a surgery that requires a lot of thought. You have to think it through. You can't just go and do an operation. A very good operation done in the incorrect patient is not going to work.
True.
It requires a lot of hand skill. The learning curve for spine is so excitingly difficult that you want to do that.
Right.
The results potentially, the right surgery by the right surgeon in the right way, done correctly, can literally change lives like no other surgery can.
True.
It requires a lot of temperamental elevation. You have to slowly grow out of your old self and now become a Zen state surgeon. You got to be able to be at your coolest temperament and go through those 6 or 8 hours of surgery. It's like meditative,
Right.
if you ask me. I mean, it really gives you a high. Yet you got to be courageous. You got to be dynamic. You got to be able to deliver the punch when it's needed, and take the back seat. When you need to slow down when you need to.
Right.
Apart from that, I think humility is something that this specialty teaches you.
True.
So it makes you a complete man, if you ask me. You
Right.
become a gentleman surgeon and not just a random person. So I think that just drove me to spine surgery. The downside in 1999 was there were no spine surgeons. So
Okay.
this specialty actually almost didn't exist. I mean, there were 3 or 4 people in the country who did only spine surgery, and it was hard to find a mentor, or it was hard to locate a mentor. And then suddenly after 2 or 3 years call yourself at a ripe young age of 30 something as a spine surgeon was going to be difficult.
Right.
But then I knew that now I had found my path. I'd found my Guruji, my Guruji, Dr. S.Y. Bhojraj from Bombay.
Okay.
So once I found a mentor, I saw the path. There was no looking back. And fortunately, I was not struggling to make ends meet.
Right.
So there was not a big family dependent on what I earned. So, as a doctor in your early career,
Very difficult.
in a fairly long part of your early career, you don't make any money.
True.
And you should be ready for that. And you should go home with that smiling face that you had a good day, a good outing there, change some lives. And that should, fill your stomachs.
So when you talked about Guruji, for me in my orthopedic career, it was Dr. Shailesh Hadgaonkar, late Dr. Ketan Kurjekar, who really influenced me to take up spine. How much did Dr. Bhojraj influence you as a mentor?
I think 100%. I think though it's not been spoken out there, I think mentoring is something that is far or as good as parenthood.
Right.
I think to mentor someone requires so many skill sets, because for those who don't know this, a medical mentor is the typical guru shishya parampara. It's not just someone who teaches you how to do surgery. It's someone who teaches you how to live,
Right.
what sort of breaks you take, how to, develop your personality, how to look at life in a larger picture.
Right.
Besides taking good clinical judgments and clinical, delivering good surgery. So I think if you find a mentor, you're amongst the luckiest of the few surgeons who's found their mentor, because that mentor you just have to blindly follow, and the path just leads you. Of course, a point comes where you can make small diversions,
Right.
but you always have. I mean, I'm sure that when you're in a difficult situation, you shut your eyes and say, "What will Dr. Hadgaonkar do in this situation?" And the answer comes out, and you just do that,
Absolutely.
and that makes life so easy.
Yeah, because I think the mentor, as you mentioned, how to examine a patient, how to talk to a patient, how to come to a diagnosis, everything is when you watch your mentor, and that builds your career to whatever you become right now. So I think having a good mentor is something at most important.
But I think even harder is being a good mentor, because you've had a mentor, you've had your luck, but now you got to pay it forward.
Right.
And to become a good mentor requires qualities that are far more than to be a good mentee.
Okay.
And to develop those qualities is a never-ending process. I mean, I'm still learning. I'm still trying to, imbibe stuff and understand what my mentee needs, and trying to, modulate my personality to
Okay.
become a good mentor.
So when it comes to clinical skill sets, how important it is now, especially in a field of spine, I think clinical examination is very important. What are your do's and don'ts during a clinical exam when a patient comes to your OPD?
I think the old adage that listen to the patient is not more important in any other field compared to spine surgery. Because, I'm just jumping guns. I'm going to say that everyone's MRI is going to show slip disc and disc bulge and everything.
Right.
So this is one field where you cannot rely on investigations as much as you need to rely on symptomatology. So you got to ask the right questions to get the right answers. Of course, the patient volunteers complaints,
Right.
but you got to declutter them or deconstruct them and put them in your little algorithm, which you've built up over years of practice.
Right.
Ask the right questions, get all the information on the table before you even open the packet to see the X-ray.
Right.
And mostly, if you've got this right, you will almost know what the X-ray or the MRI is going to show, and lo and behold, that's what it shows. So it should go that way.
Right.
And it should not go the other way where somebody sends you an MRI scan and you look at it and say, okay, you probably need an operation, and then you see the patient who's running around and playing football. I mean, that's how it goes. So
Right.
I think
And
it's critical.
Right. And how important is in this current era, all practitioners are very busy and do not have enough time to give to the patient or listen to the patient. How important do you feel giving time to the patient?
So, I'm one of the busier doctors in Bombay, but I don't give anything less than 20 minutes per patient,
Okay.
even today.
Right.
Because I believe that my entire practice, which falls back on reputation, which falls back on results, which falls back on your diagnoses, I think that all depends on the time spent with the patient. And
Right.
you also need to know when not to treat, when not to operate. Because as I told you in the beginning, a great operation done in the wrong patient would be a disaster. So I think spending time is paramount, and this is something that I try to shout out loud from the rooftops, because especially young spine surgeons
Right.
should not be worried about giving time. They really have time on hand. They are sitting, they don't have lines and lines of patients. You develop the art of giving time right at the beginning, and then it sometimes becomes hard to do short consults, and I think that's the right way.
Right.
Because we are in a very different profession. We are not lawyers, and we are not going to charge by the hour or by the minute.
Right.
And I think in the end, if you're able to get the right diagnosis, nail the diagnosis, as we say, in the plethora of complaints that come, or plethora of stuff that you see on the reports,
Right.
I think you stand out ahead of the crowd. So I think the one message, and I'm glad you brought this out, is you should spend time with your patient to be able to give the right decision.
Apart from giving time, something which I learned from Dr. Shailesh is bedside etiquettes or bedside manners. Uh, do you think that is important when you go to a clinical patient?
Yeah. So I think manners comes to us naturally, but I think what you mean is compassion.
Yeah.
Compassion is really trying to understand that patient's empathy,
Correct.
trying to understand that this guy is in trouble. He's saying these funny things because he's in trouble. He's not you. You're sitting in a comfortable office chair, you're doing your day's work.
Right.
He or she comes from a very different background. And it may not be the person who you're happy to go for a dinner or a drink with. He's
Right.
not that person. But you still need to elevate or pull yourself down or pull yourself to the side to his level.
Right.
Try to get into his little capsule to understand really what he wants and what he's saying. So that empathy and compassion, which sound like big words and sounds like philosophy, but really speaking, that's just holding someone by the hand and saying, okay, I understand you're in pain, let me solve it.
Right.
So this is really not Munna Bhai MBBS. It is real life, and it really matters. And if I am the patient, I'll be very happy if my doctor sat with me like this, rather than from his high horse and pronounce something. Try to understand my mind, get into my shoes, and then tell me what to do.
So now in this current era, most of us doctors face Dr. Google questionnaire. Patients come with a lot of preemptive diagnosis. Do you face this a lot?
Of course, Bombay is a city of tech geeks, and every modern. Let me confess that if I have to come and stay in an XYZ hotel here, I'm going to Google and check what sort of a hotel this is. I'm going to go in with pre-notions,
Right.
because I've read something on Google. So I don't think, you love it or you hate it, you can't get away from it, and you're yourself party to it. So why are you pointing fingers?
Right.
So I think we have to imbibe this in our practice today. Of course, our mentors or our seniors didn't have this in their practice, so they didn't have to do it. But we have to, and the next generation has to do even more. You got to learn to live with it. You got to accept the fact that any intelligent person is going to do his internet search, because internet is like a plethora of knowledge and it's got all the information out there. But at the same time, you should also be happy that he has come to consult you. He is interested in your opinion.
Right.
He's read Google. He has all the answers there. He knows which medicines to take, but yet he's come to take your opinion. So be proud about it,
Okay.
and give your opinion without the noise around it. Just tell him why he's here. And if he asks you questions which seem irrelevant, tell him, this doesn't seem relevant, or I have no experience in this field. Someone may say that I have a guy who does this magic wand and my pain goes away. Can I do it? So instead of putting that person down, it's good to say, look, I've not studied this science, so I can't opine on that. Because
Right.
if you put someone down, that person actually may be the first of a new branch that's coming up. I mean, everything grew from that. So I'm very happy to work with all sorts of pathies, as long as no one's doing any harm.
Right.
But I confess to the patient that I'm not educated in this field. Someone says that this particular electric chair, can I buy for XYZ amount of rupees? I'll say, I have no knowledge about this, to be honest, but I know that this treatment works. So whether you want to separately invest in this, I don't know. My expertise tells me that this is going to solve your problem. So I really don't want you to, from my side, go and spend that money there.
So I think maybe having a frank conversation with the patient and telling them that you do not know, rather than talking ill about the product or the person.
Yeah, and don't be taken aback. Don't be on the back foot if the patient comes and says, look, I have a L4-5 spondylolisthesis, I think I need a T-lift. Well, okay, I understand that you have the knowledge, but the fact that you're sitting out here, paid my consultation fees, taken out time from your schedule,
Right.
You want my opinion, I'm going to still tell you my opinion. So don't, I think the message there for the current and the next generation is don't be taken aback by patients who come with extra information or who seem over smart. They're not over smart. They're just normal people who are doing the normal things. And you absorb this, adapt to this, and still give what you're supposed to give rather than get influenced. Cut out the noise and get to the point.
All right. So back pain is something which is something very common, and there is a list of causes and reasons leading to back pain. Can you enumerate a couple of the reasons why?
So back pain is the top 3 reasons for worldwide doctor consults.
Right.
So it is amongst the top reasons why people go to doctors. And it is conservatively said that 95% of people in the world have back pain. So there are 3 types of people: those who have had back pain, those who are having back pain, and those who are going to have back pain. So our job is to differentiate the serious back pain from the non-serious. The meaning of non-serious back pain is something that's mechanical, related to some overloading injury, and which is self-resolving, which means that you don't need to take medicine or see a doctor. You have to use common sense and the pain resolves. For example, if you sprain your ankle in your house, you don't go seeing a doctor, right? You figure it out, you limp for a few days, you elevate your eyes, you take some anti-inflammatory, and it settles down. Right. So those back pains should be dealt with that kind of a stick, and the serious one should be kept out. But coming back to your question of what are the common causes of back pain, I think structural mechanical causes are the most common, where the back undergoes degeneration.
Right.
So as you see, your back is like a big spring mechanism which has a great shape memory, and that's what keeps your body upright. The beauty of the back is that aside of looking good, it gives support to all the organs in the body, including the extremities, not just the internal organs.
Right.
It harnesses the neural system, the nervous system, which is so critical, and it is still a mobile column. So it's a beauty of nature.
Right.
I mean, nature has really spent time making this. I think it's amongst the finest of the structures in your body.
Absolutely.
Now, because it is so intricate, it of course undergoes wear and tear. And I think most back pain comes about because we are the culprits. We don't service our back the way you use your car, you service it. You run and you then polish your shoes. You wear clothes and you wash them, but you don't service your back. But you use your back more than you use your legs, your hands, your brains, or whatever else.
Right.
So servicing the back alludes to strengthening the muscles that support the back, which will cover for the degeneration that happens internally, because that degeneration is like getting grey hair. You get it, I get it, the whole world gets it.
Right.
So I think lifestyle, your postures, your body weight, your lack of exercise, long sitting hours, etc., are the commonest reason why you get mechanical back pain. Aside of this, there are multiple causes like osteoporosis, arthritis of the spine. Of course, you get fractures, you get infections. There's a ton of stuff out there.
Right.
And then is the 20% sector where you get nerve-related back pain, where something has gone wrong with the back. You have not attended to it in time, and now the nerve gets involved. Just like you had a cavity in your tooth and you didn't attend to it, so now the nerve is involved. It's just as much as that. And then you got to deal with the nerve, which can get quite a big task there.
Right. So whenever we see a lot of patients, everyone Googles and comes out with the diagnosis that it's a slip disc. Now I see a lot of patients, even though the MRI or the clinical symptoms may show a slip disc, there is a component of an emotional or an anxiety related back pain, maybe an emotional stress at work, family related. Do emotional turmoil cause back pain?
I'm actually going to say no.
Okay.
I'm going to say that emotional turmoil can prevent back pain from getting better or can exaggerate back pain.
Okay.
But for emotion to elicit itself as back pain, I know there's a huge school of thought that assigns this as psychogenic back pain. But for many reasons, I'm going to say no. For the most is that they do have symptoms and they don't talk of shoulder pain, they get back pain. So why? The other is that they do have structural anomalies on their scans, but like you rightly said, many people's scans have that. So honestly, if you leave the yes or no out, the correct or no out, the way to address this is that you don't tell them that this is emotional back pain. You tell them there is a problem and that's why you're getting back pain. But if you can reduce the stress, you will get better sooner.
Right.
So that makes everything legit. Because if you tell a person who's anxious that, look, you're anxious, then sometimes it backfires and he gets more anxious. That's been my experience. So I normally bring it to the table, but from the back door.
Right.
And of course, helping your anxiety and reducing your stress and resting well will contribute heavily to getting a good recovery.
Okay. So is majority of your back pain patients treated with medications or physiotherapy, or what are your other modalities?
Yeah, so medicines and surgery have a very, very limited role.
Okay.
I'm going to say 10% or 15% patients in my practice actually need intervention, which is surgery.
Okay.
I would say 80%, 70 to 80%, the bulk of them need correct diagnosis, counseling, which means that mostly I deal with people who with a reasonably good intellect, because I live in the first world city in the in the neighborhood that's like the top neighborhood of Bombay.
Right.
So the people who come to me are educated. So if they understand why they're getting pain, they almost know what caused it, and they almost know how to take care of it, because most of it is mechanical.
Right.
So counseling, diagnosis followed by counseling, involving lifestyle changes and personal changes. So personal changes may involve changes in your diet, changes in what you're eating, the way your body weight, the exercises you do. Sometimes you have to modulate them. Some people do too little, some people do too much. You got to tell them what is good for you. And then medicines have really a small role. Mostly medicines are typically vitamins. As of today, vitamin D deficiency is ubiquitous across India. True. And it's not because of lack of sunlight and exposure to sunlight. It's because in urban dwellings, the ozone or the ultraviolet penetration is completely depleted because of the smog layer. Oh. So even if you're out in the sun in a city, you're not going to get your vitamin D. And vitamin D is one of the key vitamins to keep your muscles and bones in good health.
Okay.
So those are the only vitamins you use. Use of painkillers, I think, is mentioned to be condemned, because they are okay for that stopgap arrangement that I have to sit and do this interview with you and my jaw or my tooth hurts. Of course, I take a pain, but that's not going to treat my pain. It's not going to treat my problem. It may take my pain away.
Okay. So you mentioned a word of intervention and spine surgeries. Now, generally, spine surgery is something which all over India or maybe all over the world, people are concerned about whether I'll become paralyzed, whether I'll become bedridden. Why is this fear for spine surgery alone?
I think the fear is natural, because you're doing surgery on one of the most vital organs in your body. So I worry if someone's messing with my tooth. Of course, I would worry if someone's messing with my nerve. But to be fair, these surgeries are done so you're not bedridden.
Right.
They're done to prevent you from getting bedridden. Though it comes with a baggage. Like up to the 70s and 80s, our diagnostics were very, very limited. Like MRI was a breakthrough in the diagnosis of spinal disorders.
Right.
And just imagine a life before the MRI scan, where you had to do surgery without actually knowing what's happening inside and figuring out once you go inside. Of course, we had funny results, I'm going to say. They were erratic results. They were not necessarily bad results. They were still spine surgeons at that time. But to give them credit, their due credit, they didn't know what they were getting into until they went in. Right. So the results were very patchy and iffy. And that's probably the reason why the traditional fear of spine surgery existed. But I must say, on the same background, that today that fear seems to not be there. And the acceptance of spine surgery is now universal across the board, across the world. And they trust you to handle their nerves well.
So has the results changed in spine surgery because mainly new techniques have developed, or is it the awareness of spine surgery is more in the community?
I think 3 or 4 factors. One is the diagnosis, like I said, the advent of better diagnostic tools, so we know what we are addressing. The other is good anesthesia. Okay. Anesthesia has played a huge role, and now it's so smooth to do surgery when the anesthetist is doing their job well.
Right.
The next then is development of skill sets among surgeons. So now you have subspecialists, someone who does only spine surgery. So if you're doing 300 spine surgeries a year, you obviously are going to be more skilled than other people or another generation. then is the awareness. People realizing that, so people then coming to the specialty,
Right.
and then everything grows. Like there's a buyer and there's a seller, so the market grows.
Right.
And I think all these have, and of course the demand, I must say that the demand of people has now significantly changed. Like now it's not uncommon for me to do surgery in a 19-year-old badminton player because he wants to play better. He has some pain. He's not crippled. I mean, when you look at these guys, but he wants that pain to go away, and because he wants to perform better.
Right.
So the question of quality of life surgery was not in existence in the years gone by, but now that has come to fore because people's demands have changed.
Right.
Older people are living longer and living healthier, so they want their bodies to be with them.
Right.
So I think all this has caused us to get busier in our practice.
Okay. So one of the most commonest causes of back pain is slip disc. So why is it really so common among younger generation now that we see a lot of slip disc in younger
So
people?
before I answer that question, I'm going to give a quick gyan about what is slip disc. That
Okay.
in your back, there are these spring mechanisms, or we call them shape memory pillows,
Right.
which are designed to take the load of your body. And that load happens 18 hours of the day. Even while we're chilling on this chair, we're loading our discs.
Right.
It only offloads when you lie down, which is going to be 6 or 7 hours in the day. So a structure that is being loaded so much undergoes the wear and tear in the form of loss of shape memory. Like any sofa that you're sitting on, it has a memory or a life. And once this starts losing its tenacity or its capacity to absorb loads, it starts to give way and it becomes like a loose bearing in your back. Yet you continue to spend those 18 hours loading it. So naturally it starts going south.
Right.
And it always gives its first signals with back pain, back stiffness. You say, oh, I used to play 3 games of tennis and I was fine. And now in 2 games, I start feeling stiff in the back. Or, oh, every morning I get up, my back is stiff. You tend to ignore them. And my, sincere request is don't ignore these symptoms because this is the time when we can prehabilitate you and not let you go into the stage of slip disc. It's very, very predictable.
Right.
So if you ignore this thinking that this is a standard pain everyone gets, you tend to start going south because it's like once you have a chasmeka number, it's never going to get better. You may as well wear your specs before it gets worse because only timeline to get worse. So similarly, if this weak disc is not attended to by making your lifestyle changes,
Right.
the disc starts to give way and eventually it opens up. And when it opens up, a part of it spills out because it's always under the load of the body. And what spills out hits the nerve. And when it hits the nerve, it's a different kind of a lancinating leg pain. And that's really what is a slip disc.
Right.
So slip disc translates to nerve pain, which goes from the back to the butt to the leg, which is of a 10 on 10 denomination. It can be associated with tingling, numbness. It's there even at rest.
Right.
It can be associated with weakness. And the primary reason why people get this is because they ignore their symptoms. And the common reason why young people get it is because they are overloading their backs without servicing it. Right. You're going out there doing taekwondo, doing weightlifting, but not really looking after the strength of your body to do weightlifting and to do taekwondo. Are you fit for fitness? Ask
Right.
yourself that question.
Okay. So, very interesting. Now, when a patient comes with a slip disc, he's already had the diagnosis in his mind or he's Googled, should he first visit an orthopedic spine surgeon or visit a physiotherapist or subspecialties apart from medicine?
So it may sound prejudiced, but I'm still going to say the first stop shop should be a spine surgeon because he's the guy who has to declutter this diagnosis, evaluate the whole picture because he or she understands everything. He needs to make a plan.
Right.
And then all the other people are parts of this plan. And in a good way, the orthopedic or the spine surgeon does not then have to get involved in it.
Right.
So like I say, all my patients need a physiotherapist, 100%. You see, so ultimately it's going to go to physiotherapy, go to nutritionists, go to, lifestyle experts, but let the specialist make that plan, make the, join the dots and then go back because the other specialties are again physiotherapist, for example, is a physical therapist. So that person knows what exercises help what muscles. So they should limit their game at that and they're great at it. And even I go to a physio when I, have a problem, but that is for that requirement.
Right.
A nutritionist knows what food helps build muscle, what food helps lose weight, etc. A lifestyle specialist knows what sort of chairs you want to use, what is correct ergonomics, etc. So these subspecialists become a part of the jigsaw puzzle,
Right.
which is controlled by the spine specialist.
So I think the captain of the team should be the spine surgeon.
100%, because then you get it right. You're working from top to down and not
Right.
randomly getting into the way.
Okay. So one of the commonest reasons what I feel patients hesitate to come to visit the captain or the spine surgeon is that the doctor is going to utter the word surgery. Does every slip disc need surgery?
So the simple answer is no,
Okay.
but the complex answer is that it lies in the name. We are called spine surgeons, and there is no specialty as spine physicians. So it's natural for a patient to worry, because if you go to a carpenter, he's going to ask you to cut wood.
Right.
If you go to a surgeon, he's going to say do surgery. So I think at the bottom of it, you need to understand that the spine surgeon is a spine specialist.
Okay.
He's not a spine surgeon. And of course, he also does surgery, but this kind of a specialty never developed where you could do spine specialty without being a surgeon. And hence, you're a spine surgeon. A spine surgeon is the person who's trained in the art of treating spinal pathology for more than 2 or 3 years. So he spent a lot of quality time with a quality expert. So he understands the entire business of back pain and neck pain. Coming to the question about does every slip disc need surgery, the well established evidence based resounding answer is no. Only 10% of slip discs actually end up needing surgery,
Okay.
which is like it sounds so odd.
Right.
But the fact is that 90% of slip discs are self-resolving.
Right.
It is just that you have to use common sense. And because you're not the subject expert, the subject expert has to tell you what common sense means.
True.
To just follow the signals, follow the track. It can sometimes be time-consuming, but it is self-resolving. Like any injury in the body, it is self-resolving.
So what are your indications for spine surgery? When do you commit to a patient for surgery?
Assuming that we are talking of a slip disc and surgery for a slip disc, I think the indications are cast in stone. I mean, someone who has a nerve compression leading to a paralysis, like a neurology, a foot drop, a weakness in the leg, it's too risky to wait on this person because things could rapidly go south and they may not recover. So I think a slip disc with pain and neurology would be the top of the heap in terms of indication. Recurring pains would be the next, which means that someone who's tried to do non-surgical conservative means, but it's failing and he keeps getting pain and his lifestyle is significantly getting affected. And sometimes a slip disc that has come as a backdoor entry in a pre-existing pathology, which means that there is some other pathology growing inside and slip disc has just got him to you. You would then say, that use this excuse and get that pathology sorted. Typically a spondylolisthesis or a lumbar canal stenosis where the bone is gradually growing on the nerve and the nerve is getting caught. And you see through your experience, you can read that this person is going to need an operation sooner rather than later.
Right.
You could use this time and then bail him out of his excruciating pain and use this opportunity to actually cure him.
So whenever we utter the word surgery to a patient, the first thing patient would ask me is, doctor, can I use a lumbar belt? Will it help? Your opinion on a lumbar belt?
So a lumbar belt was designed to give you false abs. And that comes to my primary point that if your abs are good to begin with, you would not need a back operation or even to see a back specialist. So I think we must understand that developing abs is the correct way to treat or to preempt a back problem. Now, once you already have a back problem, how do you develop abs? Right? So that's where the lumbar belt comes in, that it bails you out, gives you some downtime. It, pulls your tummy inside and holds your back up. You could do that right now. Just pull your tummy in and your back will feel very relaxed. The problem with the lumbar belt is it gets addictive because when you're using it, the muscles are chilling. It's like spoon feeding. And then the muscles start to actually regress. So in the bigger picture, it's more of a harm than a good. But in a stopgap short arrangement, a belt does help.
So does your conservative treatment per se have a little bit of belt usage?
So the conservative treatment, very simply put, works around 4 big verticals.
Okay.
The first being modulation of posture. So, and the simple thing is whatever hurts, don't do.
Right.
Just because the doctor or the physio said don't do it, you follow your body language. So posture and ergonomics, how you sit, where your screen should be, etc. The next is exercise, and exercise of muscles that you've never ever heard of. Muscles that support your back, abdominals, obliques, sides, not the muscles that are show muscles that you go and work out in the gym.
Right.
The third is nutritional management to optimize your body weight, because that becomes a big culprit. I mean, we all assume that at 50 it's okay to be 20 kilos heavier than when you were 30. Well, that's wrong. Your body was designed for this weight. Your best adult weight is what you should die with.
Right.
So if you're gone 5 kilos overweight, it's like you walking with a 5 kilo bag all day. Of course, your back and knees are going to hurt. So getting your body weight gradually in a sustainable way, getting it down,
Right.
would be the third, and the fourth would be ergonomic endurance workouts. So building up endurance, because remember, your back muscles, unlike your leg and hand muscles, are endurance muscles. They need to sustain a good tone for 17, 18 hours of the day. So stuff like brisk walking, swimming, cycling should be another arm of this entire conservative treatment.
Okay.
Now you heard me, and I didn't mention the word belt. I didn't mention the word apparatuses. I didn't mention the word medicines, because these become very, very peripheral bailouts in specific situations.
Right.
But if you go to a person who comes to you back with back pain saying, take these painkillers, use this belt, he's going to work out feeling better, and then he loses the big picture. And the minute he stops that, he's back to square one. So you've actually done disservice. So I'm not going to mention these to my patient till the very end, and then tell him that if you're really suffering, you can take these painkillers, rest a bit, wear a belt or use hot packs if you wish. But that's a stopgap bailout. It's not your treatment.
But in our current generation, what happens is that if we don't give a belt, if we don't advise medications, and we only talk about exercise, the doctor is not a good doctor.
Yeah, but it's up to us, Vivek, to change that. Because if I tell the person why I'm not a fan of a belt, he's going to immediately understand. Because ultimately, he's come to you for an opinion, and you're giving him an opinion which is good for him.
Right.
It makes no difference to you if he buys a belt or not, right? You're saying something that's good for you. So if I tell you in right earnest, this black shirt doesn't look good on you, you should take it well. Because what do I have to gain by saying this black shirt doesn't look good on you? So it's something that's told by a specialist subject expert. If you can wrap it correctly and say that, this is the treatment that works. There is shortcut treatment like painkillers and belts. Let me tell you that when you take a painkiller, your pain hides. And if your pain hides, your warning signs go away, and you start doing things that you're not supposed to be doing. And pain is actually your friend.
Right.
And you should use pain as the guide to your improvement and your actions. Oh, then it really dawns onto them. Oh, I understand why I should not be taking medicine. Similarly, if you tell them about the belt,
Right.
that you make your internal belt. A belt is great, but make your own belt and don't rely on an external belt.
Right.
They would, I think, take it home. So I think it's up to us to really educate them rather
Right.
than just say, oh, belt is rubbish.
Right. So now coming to post-surgery. Now we have operated a patient. Generally, everyone is worried is how long they should take rest post-surgery. Considering the scenario is a slip disc, what is the earliest a patient recovers?
I think in most spine surgeries today, the person is permitted to get out of bed the same evening if it's a morning surgery, or the next day if it's a day surgery. So there's like zero rest. The surgery is done to fix the problem that needed rest. So
Right.
we are very enthusiastic to get them out of bed. Of course, that doesn't mean that he starts attending office the next day.
Okay.
So there's a whole process where the wound has to heal. Like, it's common sense. So even when I had a hurt on my forehead, there was a downtime before I could go back to school, right? It had to heal.
Right.
So here, healing takes 2 to 3 weeks. So while they are not confined to bed, they are encouraged to be mobile in and around the house, even take short drives. We like them to attend office and external, resources in the third week normally.
Okay.
That's about the time when we start, putting the content of basic exercises, going for walks, going for swims onto them. And it's about the 3-month time that we open up the doors for sports.
Okay.
And, I'm saying at 6 months, they can really optimize their sports, start lifting and start doing heavier stuff.
So little bit high impact sports can be considered after 6 months.
It's horses for courses. So if there's a sportsman who's come for surgery,
Okay.
he resumes much faster because the constitution of his body is designed for that.
Right.
But if it's a white collar person who then says that, look, I play tennis but not regularly, and then I say, look, why don't you get fit? Use this opportunity. You've had this surgery. Let's call this surgery as something that got you to the start line rather than the finish line.
Right.
And let's now start running the race and invest time, become fit, and then of course play sport. So that process takes, I'm going to say, 3 to 6 months.
No. But generally, I think it's more of a clinical judgment. As you see the patient, you decide what is best.
Yeah, I mean, it depends also on his needs, his common sense.
Right.
Like let's leave sports aside. Let's talk about the labor class. They need to get back very, very soon.
Right.
But these guys are ripping strong. They've been doing that kind of labor. So
Okay.
picking up 50 kilos may be, outlandish for us, but for them it's a daily job. So I would not hold him back from doing that sooner.
Okay.
But someone who's never done it should not now start doing it just because he had a spine surgery until he's fit.
Okay. So do you normally advise your patients to start driving in 3 weeks' time?
Actually, driving is sooner. I've had people drive out from the hospital home.
Okay.
Of course, short distances, because driving is nothing more different than sitting like this, and they're sitting like that and having their meals.
Right.
So honestly, driving is not a big deal. Even people make a huge deal about two-wheelers. I don't see that as a big problem because you're driving it. You know that there's a pothole. You're not going to ram yourself into it. So as long as you're worldly wise, I think most domestic activities are permitted ASAP. Of course, different people have different pain thresholds.
Right.
So if pain is holding you back, you may want to go slow. But otherwise, I would not stop you from doing anything you wished.
Right. So normally post a spine surgery, generally patients do come to us with some tingling, nerve irritation, numbness, and with pain. We always counsel the patient that the pain will go, tingling, numbness may persist. So when a patient comes even after a month or two with numbness, what is your way of counseling that things will be all
So I
right?
think it's a great point you brought about that when you're doing a nerve surgery, you're only taking care of the mechanics around the nerve. The
Okay.
biology of the nerve is not in your hand. So for example, if I cut myself and then someone took stitches, I've mechanically put the skin together. But how long it's going to take to heal is the matter of the skin and its nutrition and its biology and its constitution. So nerves are notorious to improve physiologically much slower than other tissues in the body. Sometimes they don't even recover.
Okay.
Sometimes they don't recover. So they are quite the organ in the body that is the most delicate organ. Pain comes out of inflammation. As
The
soon as
chemical markers, mediators.
yeah, I mean, as soon as the mechanical force on the nerve is gone, the pain goes away because the
Right.
inflammation of the nerve is gone.
Right.
But it's like if I pulled a thorn out of your skin, but well, the red mark is remained and that's going to take its time. The wound is going to take time to heal. So that's the time that a nerve takes to heal.
Right.
So the coming back to your question is how do you counsel a person who has come with an expected symptom? I expect him to come and say that my foot is still numb or still feeling tingly, but he's not, he's dissociated in his thought. I'm going to say that, earlier pain was there with numbness, which was a red flag.
Right.
Now there's no pain. So get used to this numbness and get on with life. Don't think of this numbness as a roadblock to your activities. You'll slowly get used to it. And by the way, it will also reduce. But don't, because for them, they interpret it as a bad symptom.
Right.
And as soon as you dissociate the two, they're normally okay to live with it for a short time or sometimes a longer time.
So do you feel counseling these symptoms pre-surgery makes a difference?
100%. I mean, you want to give them an expectation setting. And I think this is a huge part of a successful operation. Walking them through the journey of how it's going to go. I mean, from the time they get into the OR,
Right.
it becomes your baby. And remember, your patient has put his life in your hand, his or her life. So you better be able to take a bullet for that patient if it's needed. But that person, no matter you may be seeing 20 a day, each person is a person and it's a life. So you got to handhold them through the whole process of how this surgery is going to happen, what they're going to feel. I even sometimes tell them that you're going to be on a trolley. It'll be like a movie scene for
Right.
you. You'll be seeing lights, people with masks. Don't be worried. I'll be there. I'll give you a friendly hello.
Right.
Then there'll be a needle prick and you'll go to sleep. And after that, you'll wake up back in the wards. So you walk them through it so they are kind of ready for it. And then you, of course, walk them through the stages of recovery. And today, most patients want to know, when can I take a bath? When can I walk? When can I eat? When can I bend? When can I go? Blah, blah, blah. So you normally go through that and then tell them which symptoms are. So typically, pain is going to disappear very soon, at least the nerve pain.
Right.
The operative pain may take a few weeks to go. Numbness takes longer and weakness sometimes will never go.
Right.
You have to be explicit, even at the potential cost of the patient going out saying that, no, this is not what I came for. Well, that's fine. You got to be honest.
So you mentioned something about being honest. So something what I want to really bring out in my podcast is communication between doctor versus and the patient. How important do you feel communication to the patient is in spine practice?
I think honest, clear communication in the patient's language can solve so many problems, which get created because that didn't happen. I think at this point, I must say that our profession is quite different than other professions. We are not treating clients, we are treating people. So it's a conflict of interest actually when a person with a problem that you specialize in treating comes into your clinic. It's like a juicy full toss.
Right.
But you got to be that high priest, I'm going to say, who has the courage to be able to dispose the decision that is optimum for him and not for you.
Right.
So, like it is famously said, work for outcome, not for income, and then you will get it right. So, if you look at and this honesty, will take you places, and it will give you income in the end because your practice will become so heavy because people realize that okay, this guy is an honest guy. He tells you something that comes from what he thinks is correct for you, and he has no other motives in your head, he or she. They start flocking to you, and that then retrospectively looks after your income. So I think you get the best of both. So I think an honest communication of what you're able to deliver and what you're not able to deliver, I think is paramount to creating a good patient-doctor relationship.
So I think I really like this point. Something which you're unable to deliver, I think we should be able to talk to the patient that we are not skillful enough.
Yeah, I think because they all know that you're not gods,
Right.
and though they respect you a lot, they will respect you even more when you expose your shortcomings to them. And they should know that the person who's going to work on me is good at this, but not good at this.
Because sometimes our ego is such that if I lose this patient, I will lose my name, but sometimes ends up in a disaster on table. So I think knowing your skill sets, knowing your shortcomings is something important for
And
clinical
also,
practice.
Vivek, differentiating ego, this I'm talking surgeon to surgeon, differentiating ego from insecurity. They're two different things. Ego is an inherent characteristic,
Okay.
and an ego can be used in a good way also to deliver, deliver high performance. But of course, you should shed your personal ego and use ego to get good results, like use your ego correctly. But insecurity is something that is a curse in the medical profession, and you should not feel insecure that you saw me for your complaints, but you got operated by Vivek. Well, you wanted that, and my job, you came to me as a consultant. I've given you my consultation. You come to me for surgery, I'll do surgery. So no one owns a patient. It's not your patient. It's a person who's taken your time, which you have on offer,
Right.
has paid you your fees and taken your opinion. So you should not then hold on to that. And that insecurity that this patient will run away from me is, I think, it's so stupid. I'm going to say stupid is a bad word, but it's something that should be weeded out of our community because that will make the world a much easier place to work with.
Right.
It'll make inter-colleague interactions so much easier, and even patients will not get bogged down by this hassle of taking second opinions and third opinions, worrying about hiding them, etc.
Because always in our phase, in the younger generation phase, we explain to a patient and suddenly we realize it has gone to one of the seniors or maybe our boss, or sometimes the boss has seen the patient and somehow it has come down to the junior who has done the surgery. So always, as you mentioned, there is an inter-colleague disruption, but I think understanding that it is finally the patient who makes the choice and the decision.
Yeah, and because it goes both ways, what goes around comes around.
Right.
And the junior should realize that he's junior, and the patient will seek
A senior
more
opinion.
experienced opinion, but I will still get my share. And the senior, on the other hand, should feel happy that his junior, because imitation is flattery. I mean, if my junior he felt good enough to do this operation, that really hones good for me. Like I've done a good job. I mean, that's how I look at it.
Okay.
So I'm more than happy for my junior to be the surgeon of a patient who I've consulted. And the junior should also realize that this guy has been in the field for 15 years more than me.
Right.
So he deserves that much more, and I will get there. And today I still have my share of practice. So then that becomes easy.
Okay. I think this is something really important for the current surgeons, because we are always in that discussion. My patient has gone to him, his patient has gone somewhere else. I don't have enough patient base. I'm losing on my income. So this baffles the current.
What will calm your nerves in this situation, it's always worked for me, is to immediately speak good about that person. So if a patient of mine who I've counseled for a surgery comes to me and says, "Thank you, sir, but we are planning surgery with Dr. Vincent," I'm going to say, "Oh, he's a very good doctor. Don't worry. I think you will get a great result. I'm happy that you've chosen him." Immediately, it'll calm me. I may be bluffing through my teeth, but it'll calm my nerves down. It'll create a great harmony between me and my colleague,
Right.
and the patient will go out feeling happy. Ultimately, the result of surgery is, again, I'm going to go back to destiny. It's not destiny, it's your skill sets, it's how much effort you've put in. But the result is each one's own, again, destiny.
Right.
So, and you're not going to be able to help that guy. You're not going to say, don't go to Dr. Vincent, you please come to me. You're never going to say that. So you may as well, make this smooth. And that give and take will, nurture better relationships among specialists. And then suddenly everything will become watertight and happy.
Right. Now, coming back to our spine surgery, something which is not really talked about in the open is when can a patient get back to physical intimacy with their partner? After spine or a disc surgery, when can they get back?
So sex is taboo in our country, so it's not talked about. But
Right.
internationally, we also run this website called Sex and Spine.
I see.
So not only surgery, but even with back pain, how do you intimacy and the physical act of sex? How is that possible? And there's enough literature and data out there. There are even studies done.
Okay.
But the simple thing is that once the wound heals, so moisture, etc., is not going to be an issue.
Right.
You're good to go as
Okay.
far as physical intimacy is concerned. But common sensibly, Kama Sutra has given us thousands of positions. I adopt a position that is user friendly. So the fundamental of ergonomics, the fundamental of exercise and preparation remain. And one of the taglines I say is that consider sex as a sport.
Okay.
And prep for it and go and play the sport and enjoy it. Do it in the right way.
Right. So we got a lot of information about spine surgery, but every surgery comes with a set of complications. What are the earliest complications a person can expect post spine surgery?
So again, assuming it's a surgery for a slip disc, because
Right.
spine surgery covers a plethora of some very risky operations. A slip disc is one of the most safest and reproducible surgeries. And I would quote a complication rate of under 5%, which is
Okay.
pretty low. And none of these are typically threatening complications. They're mostly reversible complications. To cut a long story short, about 2% people can get infection in the wound, which can happen over all across the globe. And that may need extensive antibiotics, sometimes wound care. So that may, take your story slightly longer. And about 2% often, not often, but need re-exploration.
Right.
So re-exploration can be because of a number of things, but in short, what it means to the patient is that on day 3, he was promised that he'll go home, but he has another trip back to the theater. The doctor has to open up, remove a hematoma or a blood clot or maybe a fragment of disc that's come out again. But eventually that sets it right. So he's not left, handicapped for the future. The issue of spinal injury is almost non-existent in a slip disc surgery, simply because slip discs typically happen below the L1 and the spinal cord ends at L1.
Okay.
So you can really manhandle the nerves there. You can really be a bad surgeon and still not hurt the nerve. So it's pretty safe in the sense of, one of the quoted figures of nerve injury during a slip disc surgery is in the 0.2% category.
Okay. So now, when we talk about complications, yes, definitely the patient does get affected, but there is an emotional side to the treating doctor also. Do you get affected when you see your patients in complications?
So you're opening a Pandora's box because there have been suicides amongst doctors. See, we are high performing individuals. We are used to high performance. We are used to good results, and we are in a high stakes industry because you're literally dealing with lives of people. And if because of your surgery somebody's life has gone south, and here we talk about cervical spine surgery and deformity surgery and the more complicated surgeries, it can affect you significantly. Okay, so you're human and it's going to affect you. On the flip side, if it affects you, you still have to go out there and do your day's work the next day.
Right.
So I'm going to draw a parallel to a pilot. If he's had a rough landing or some episode in the air, he's designated to sit out for emotional rest for 3 weeks or sometimes 3 months. We don't have any of that. So if I've had a bad outing in surgery and I'm traumatized as the caregiver, I may in the next 30 minutes be on another patient doing another surgery. And at that point, if that baggage makes me do another bad operation, that's not okay. So while this is going to happen to all of us, we need to also remember as surgeons that we need to spend time and spend efforts to make our minds resilient and be able to work in almost a robotic manner without the baggage of emotion affecting your next performance. You can go home and cry, but you should be in a capacity to modulate your emotion, to be able to give high performance time after time after time. You cannot say I got out on a zero in the last match. Oh, I'm at my career's at stake now. How will I play and get out at zero again?
Right. So now in a city of Bombay, is mental health about doctors spoken about or treated?
It's almost not spoken about, not treated, and you every now and then hear about even suicides amongst doctors. And I think this is one of the dark sides that people have not talked about. And all I can say is that we can preempt it. It's going to come to you sooner or later. Some kind of a backlash of a badly performed surgery or a bad clinical judgment or a bad diagnosis, because you're human.
Right.
So, my own game against this, predicting that this may happen someday, is to build up myself in what I call the zone of discomfort. And I spend a considerable amount of my time climbing big mountains, trying to face adversity in controlled conditions, running a marathon. When you're running a marathon, you run the first 10K happily. On the 18th kilometer, you're about to die. You're like, why am I even doing this?
Right.
If you have the resilience to still go and finish the next 3 kilometers, that's where you've trained yourself to work in high pressure situations and still give your best. So this kind of stuff, and of course relaxation like music therapy or playing music yourself, those are the methods by which you can keep your mind in a, what I mentioned at the beginning, a zen state. Your mind is in a zen state. You are not affected by the externals. You know that you're doing your best and results are going to come. Like someone said, I treat, he cures. Fall back on that adage. Of course, don't let destiny be in your hands and let your hands do the best. But everything is not in your control, like it is for all of us. There could be an earthquake here today. So don't lament about it. Worry about what you can change. Don't worry about what you can't. And get your mind to a position or say cultivate your mind to be able to take these adversities and still perform brilliantly.
Should doctors seek help from uh, mental health therapists?
The answer is debatable. If you're able to control this yourself, because I personally believe that high adrenaline workouts can build up endorphins and serotonins, which are the treatment of your depression.
Okay.
So I fall back on that. So when I go for a morning run before a big operation, it's mainly for that. It's developing the happy hormones and I'm in a good mental state to do the operation. If I've had a bad outing, I'll still go for a run or go and do some heavy workout. Some people prefer meditation, which also works in diametrically the opposite way, but works in the same way for the mind. Those who don't have this resource in their hand
Right.
probably should seek help of a specialist, and there's no shame today. And I must admit that the psychiatrist is the busiest specialty in urban India today.
Do you feel, since you've been one of the uh, most important people of the Association of Spine Surgeons of India, should this topic be spoken about in that forum?
Yes and no, because sometimes the more you speak about it, the more you start looking at it and start over analyzing yourself. At the same time, I think your suggestion, I never actually thought about it, but it's a great suggestion going forwards, because we are now performing more complicated surgeries, we're getting busier, life is getting more westernized. So I think a time will come when this will be a necessity. So I think it's a good reason to start this little subset of mental health, preempting mental issues amongst doctors. Yes, like a counseling chamber maybe.
So now, since you perform high-end surgeries, it's just not a single man's job. You have a team, and to what I understand, you have a group called as VR Spine. What does your team comprise of, and or what is VR Spine?
Teamwork is very, very important. It's like just like Virat Kohli can't win a match for India. The team has to win a match. And the sooner you realize your ego makes you not feel, your ego wants you to be the guy. But that's not true, because different people perform at different levels and that team gets together and gives the best result. So the idea of teamwork is multiple, the most important being subspecializing.
Right.
So you get better and better at one part of this whole segment of spine surgery. You get in another person who's good at another part and another person who's good at another part. The difficult problem being that how do you gel with all these guys who come with their own egos and their own surgeon mentalities?
Right.
If that part is circumvented, which in our case we have, because
Okay.
we come from the same family, as we say, the same guru,
Right.
we all, from the same mentors, we all know the hierarchy. You can give very, very specialized, very high-end care by having a team. Number two is that there are two surgeons for every case, and that's always going to be two sets of eyeballs, two sets of hands, two sets of experiences. So it's always going to give you a better feel. Number three, I'm sitting here in Cochin and doing an academic workshop, but my work is not suffering. My patients who need to see a doctor, they have someone to attend to,
Right.
who's being looped in with me. So I think on all fronts, having a team is good. It's a win-win. Good for the patients, good for the doctors.
Right. I have heard that you have a non-profit organization which looks after patients in the interiors of India and in Bombay and different parts of
Yeah,
India.
the Spine Foundation.
The
We call it
Spine
the Spine Foundation.
Ah.
It's again, the dream and creation of my mentor, Dr. Bhojraj. But Vivek, you know as much as I do that we've all come to where we are thanks to the poor Indian patient, because we have learned using them as our, if you say, guinea pigs. So we all doctors in India, I say specifically India, owe it back to the society, and we come with that notion. It's inherent to most doctors you will see around you. So the minute you get an opportunity to give back, you want to give back. Now this opportunity got created because we understood from studies that even in a country like India, rural India, like 70% of India is rural, and in rural India, one of the top reasons for disability was back problems. So it was not like I'm a back surgeon, so let me go and give back treatment to the farmer. It is like they need it and I have it, so let me give you that treatment. So based on this, we've developed now almost 20 centers across rural India. This is strictly rural India,
Wow.
where there is no access to healthcare. And now we do surgeries on a regular basis. So twice a month, actually, every 15 days, some members of our team are out there in some far out place doing exquisite spine surgeries and seeing patients, and that is a source of great satisfaction, and I hope this continues like a virus.
Right. So since you mentioned that you're doing a lot of surgeries in rural India, so there is the urban India talks about a lot of gadgetry, robotics, different types of minimally invasive spine surgery. How much does gadgetry really is required in the field of spine, or is it more of surgeon skill set?
Yeah, so an egoistic surgeon is always going to say, no, it's my skills. But let's be fair here that all technology comes with a good and a bad arm. And the good arm has to be acknowledged because it does help you in surgery. Most technology does something or the other that benefits, your ultimate performance. Whether it is completely relevant to everything you do is the big question. Like, just to get from here to there, do you need a Lamborghini, which is an automatic, working on some fancy fuel, or you can just walk across? That becomes the key thing. So the good side of technology is acknowledged, but the downside is that sometimes we fall prey to technology, and surgeons in training are now getting used to technology, and hence without technology, I've learned driving on an automatic car, I don't know how to shift a gear. That can't do because 70% of India is rural India.
Right.
So the reality lies there, and you're not going to have technology there before you get food to eat. So in short, we should be able to adapt to both. As surgeons working in high-end cities, you should use technology. But when you go out there, you should still have your handsets and your hand skills to be able to dole out surgery in the most native way that it was done. And I think the tagline here is that think global, act local. So you don't give a poor result, you give a good result in the more traditional way. And you're born with that expertise, or you've learned that expertise, and you've been experienced, doing that technique. So you should be able to adapt to it.
Right. So now, since you mentioned about adaptation, now as an upcoming surgeon, there is a wide range of techniques. So everything to learn or to adapt is very difficult because there is a learning curve for every technique. Now you have the open technique, you have the microscopic technique, you have the endoscopic technique, you have tubular techniques. What do you think, sir? Do we need to learn all, or learn something and do what you're confident with?
So necessity is the mother of invention. So if there was a necessity, then a need, once the need is there, a solution comes up, and then you want to use that solution because your need is getting satisfied. So wherever you find that, please pursue it because you need that. Sometimes there's a solution being offered when there's no problem, and that's merely because we want to do something new. or because I want to do something that my neighbor doesn't, or because this is going to give me more patients and I'm going to be able to advertise myself better, or because the industry benefits more from this. So I would say just sieve that out of your head. And the simple way to solve this is that what I'm doing now, is it giving me bad results? If it's not giving me bad results, why should I go looking for something to change this? If it's working well for me, just work with it. So the answer to your question lies well within the question itself, that you should be able to sieve out what is really needed and go and pursue it. I personally do at least one new surgery every year.
Okay.
But I spend a lot of time thinking about which surgery that's going to be. And if you just sit back and just read journal and fall prey to what is being thrown at you, because it's being thrown at you from, honestly, from the West, but from all angles, from conferences, from thought leaders, from journals and advertisement of all sorts. It can become hard you're not an upcoming surgeon, you're already up there, but for a surgeon who's trying to make his way, it can get quite confusing, and it's important for you to fall back. And that's where again a mentor comes in. If your mentor can do this without using any of that glitz, why should I not be able to do it myself?
I think one more thing is peer pressure. We are always now, when I look at different WhatsApp groups of spine surgery, I see a person maybe in Gujarat doing something endoscopically. So I feel, am I lacking something? So what do you think?
You have to dissociate from that, because then there are people running full marathons and you're doing a spine surgery. Like, you should think of it that way, that just because he can do it, he shouldn't be doing it. Is it really needed? So again, the answer lies in the question that if there's no necessity, don't go chasing a technique, because that technique is not needed. It's not relevant to you. It's not relevant to your patient.
Right.
So don't necessarily go chasing. At the same time, if you feel that, no, I am falling short of this, 100% go and chase it up. So as far as peer pressure goes, it's natural to have peer pressure. But again, this will require a lot of character building and a lot of inherent, courage of your conviction, that I think I'm good at what I'm doing and I'm happy to be good at what I'm doing, and not try to do stuff which I may be bad at or which may be bad for my patient just because someone else is doing. It has to come from within. And I think as a doctor, this is expected of you, because you're no less than a spiritual coach. You're no less, people are trusting you. You're not that shopkeeper who has to sell something, or a salesman. So it has to come within, and I don't get any credit for thinking like that. It has to be a part of my thinking.
I think ultimately every surgeon or practicing doctor should feel that patient's results matter in whatever you do.
Yeah, like work for outcome, not for income. It comes back to that make sure that at the end you have a happy patient. That should make you happy. Everything else will fall in place.
Right. So coming to more on a lighter note, one of my fan moments with you was when I attended the Scoli week, and you had given a lecture on how important is fitness and to be fit at 50. So how you run, how you go for treks. How did that habit inculcate in you? Were you always into it?
So partly passion, partly necessity. We just spoke about the necessity bit, that you need stress busters. You need to be able to cultivate your mind to manage stress, hardships. You need to be able to produce your A game when you're under duress as a professional. See, as surgeons, we are medical sportsmen. We are people who are supposed to use our physical senses, eyes, ears, smell, hands, to be able to deliver results. Unlike physicians who have to use their brains alone.
Right.
And even people who use their brains alone. So Vishwanathan Anand, our most famous chess exponent, his comment is that I train for chess in the gym. You see, so your mind gets controlled by how your physical fitness, really. So it's a necessity for a surgeon, and I think this should slowly become a mandate, that your surgeon better be fit to be able to handle that 6 hours of surgery. That should become a mandate. And then it's a passion because, I come with this simple principle that I was not sent on earth to become a doctor or a spine surgeon. I was sent on earth to live a 360-degree life. You only have that many days. You may as well make the most of it. As far as fitness at 50 goes, as we grow older, we need fitness more. Because as you know, the muscle is the only tissue in your body that can regenerate almost. So the more you invest in it, the fitter you will stay in the times that you require it. So as we turn 40 or 50, we need to up our game and spend more time. Fortunately, by then you're settled in practice. You have that time to spend on fitness. And then, of course, doing marathon running or mountain climbing or cycling, that's your choice. You could swim, you could go for a walk. But you should be cognizant of the fact that you need to spend time on health so that you live a better older age.
No.
You don't want to, it's not about how long you live, but how good you live.
Right. So now coming to this marathon, this is always this question on running full marathons. Does it really affect your knees?
So I'm a half marathon runner, but to my credit, I've been running since age 18. Today I'll be 52 this year. So it's a long time that I've been road running, and by now my knees should have been busted. So I'm the living proof that running does not affect the knees. Having said that, so the reason for this is because the cartilage gets its supply from from pressure. When you load the cartilage actually gets nourishment. Having said that, if you have an injured knee,
Okay.
you're likely to damage it by running. So you rather be doing low impact sport like cycling or swimming. So it's not a blanket statement that running is good, but if your knees are good, you can run for the whole life.
Right. You are an ardent traveler, and you have mentioned in your talk before that wherever you travel, you always see to it that you either walk, run, or cycle. So what is your protocol?
You can see the world in a much better way if you're in the 360-degree open compared to in the confines of a bus, train, or a car.
Okay.
So I have cycled Iceland, and I've seen Iceland like no one has, because you get to see all the 360 degrees of Iceland. So that's one. The other is that many countries outside our own have stuff to offer that our country does not offer. For example, music shows are much more relevant for the music I like in the West. So if I'm going to the West for some meeting, I may as well look up a music concert of some favorite artist and attend it. So this year I'm attending Wimbledon. Okay. If I'm going to UK, I may as well attend and take my shot at looking at Wimbledon. Similarly, marathon runs. The weather, the roads, the organization is far more conducive in Western or in the Northern Hemisphere. So if you're going for a summer conference somewhere, I look up a run. So I've run the Munich half, I've run the Dallas half marathon, I've run 2 marathons in Netherlands. It's merely because I was there. I would not fly in to do a marathon there.
Right.
But because my work space involves so much travel, I try to make the most of it and try to get a bite out of every little cultural activity that is available to me, and not just go and take a lecture and come back.
Okay. Lately, on one of your Instagram posts, I saw you had a meeting with Dalai Lama. Can you enlighten a few?
So again, I'm not a Nastic. I'm not a non-believer, but I'm those guys who sits in that middle. And I don't necessarily I don't pray every day. You see, so it may be a flaw. I'm not saying you should not pray. It's just that that's how my constitution is. At the same time, there's a huge respect for people who have advanced in the world of spirituality. I'm not going to say religion. I'm going to say spirituality. And whenever you meet such a person, that aura hits you. So I had this opportunity because I was in Ladakh and I was in Dharamshala, and we had some work there. So there were 2 things happening simultaneously at that time. There was a cricket match happening. So on one day I bought a ticket and watched the India-England Test match in Dharamshala, the world's highest cricket stadium, and that gave me immense pleasure.
Right.
And on the other day, I used my good books to get a meeting with the God-man himself. And just meeting the Dalai Lama was a very, very different moment in life. So I would never spare this opportunity to meet someone who's done something great, because he has that aura and he's achieved something that no one else has. It was a great meeting.
Good. So we are almost coming to an end of our podcast, and I would like to know few pointers or advices for the upcoming spine surgeons.
So first of all, congratulations. You've made it. You have chosen a specialty that is really, really special, and thank you for joining the gang, number 1. Number 2, now that you've chosen this hard branch, up your game, develop a good temperament, weed out all the cobwebs, don't be insecure, don't be egoistic, be humble, learn from your errors, don't repeat the same error twice, don't lament over what went wrong, but don't make sure it doesn't happen again. Look at colleagues, develop good relationships with your colleagues, because they're going to help you in times of trouble. So don't backbeat them, work with them. stay academic. Don't just dive into practice. Be cognizant of what's happening around you. Try to do some research work. Try to attend meetings. Stay up with the game. Don't forget fitness, because you're going to be needed to be out there physically for hours on end as you get busy. So spend time on fitness. Of course, don't forget your comfort zone, your family, and because this specialty can really draw you in. So make time for something you like, whether it's family, whether it is music, whether it is develop a hobby alongside, and have the courage of your conviction. You're the best man for the job. You are going to do that job, and don't be nervous about doing it. I think you should have that spirit in you to be able to fight this big battle.
So I think these are all points of immense wisdom, your experience over the last maybe three decades.
Yeah, no. Yeah.
Yeah. So it's a real honor for me to talk to you, learn a lot, see you, and interact with you. So I would like to continue this association with you. And
100%, Vivek. I'm so glad that we did this. And I hope that there are people who are going to watch this and give comments and feedbacks.
Yeah.
But I'm very happy that you're doing this, and I hope you stay on this path.
Because I feel that mental health about doctors, spine surgery is something which is not to be worried about for the general public. We are ably trained because of mentors like you. So we can give good results. And I wish you, the complete VR Spine team, the Spine Foundation by Dr. Bojraj, all the best and more success in the years to come.
Thank you.
Thank you.